Well, as those COVID-19 vaccines that Eric mentioned are being distributed across the country tonight, we hear from someone who knows firsthand what it feels like to take it. Dr. Thomas McGovern, board member of the Catholic Medical Association and co-host of the Dr. Doctor podcast and radio show heard on EWTN Radio, became one of the first healthcare workers in the state of Indiana to receive a dose of the COVID-19 vaccine earlier this week. And Dr. McGovern joins me now on Skype. Welcome back, Doctor. So good to speak with you again. The answer I'm sure everyone is waiting to hear is, what was it like when you received that vaccine, and what has it been like since? How have you felt, and have you had any side effects?
They vaccinated about 250 of us yesterday in the first day of vaccination here in Northeast Indiana. And I'd have to say that the room was full of doctors who were incredibly joyful and almost teary-eyed, because it's a sign of the beginning of the end of the pandemic. It was incredibly well organized. Many of us had our pictures taken because it's such a big moment for us and for the country. And I didn't feel a thing with the vaccine. When I drove home, I was wondering, I hope they didn't give me salt water, and they really gave me the vaccine, because I felt nothing. I woke up this morning, had a little soreness in the arm, which reassured me, because I want people to realize that when the immune system causes a reaction to a vaccine, it's going to be tender, it's going to be swollen. That's normal and good. It's a sign the body's doing what it's supposed to. And now I'm exactly 24 hours after vaccination, and I really have no pain unless I push on the area. But it was a very joyful experience.
That's so wonderful to hear. I mentioned side effects. I do want to talk a little bit about possible side effects. Today, we learned that a healthcare worker in Alaska was hospitalized, and treated for a serious allergic reaction after receiving the COVID-19 vaccine yesterday. Now, This follows reports, as you know, of serious allergic reactions to vaccine and healthcare workers in Britain last week. Does this call into question the safety of this vaccine for those people who do have severe allergies?
Of course, we will be following, and the companies will be following, the number and types of allergic reactions. It's expected. It's a risk-benefit ratio with any treatment that we do. This particular person had a severe reaction. She's doing well this morning, according to reports, thanks be to God. And almost 3 million doses of the vaccine were sent to the U.S. It's not unreasonable to think 500,000 to 1 million have been given through today. So it's rare. It happens, and we have to see what the risk factors are and if it's more common than we thought. But again, when we receive things like antibiotics, like sulfa antibiotics, they also have, a rare but real risk of severe allergic reactions, yet we use them. So it will be getting more data and trying to make it as safe as possible and find out who is at most risk for those severe reactions.
Yeah, I want to talk to you about being a doctor, in particular, a Catholic medical doctor. You're able to look at this vaccine from many different perspectives. Did you personally have any reservations at all before taking it, or now as you wait for the second dose?
No, even though there is, remote use of those HEC293 cells in some of the testing, but not in the production of it, the bishops have commented. The Vatican has commented on vaccines that sometimes the need for a charitable action outweighs the remote cooperation with evil. And so to protect my patients, I operated with my face 18 inches from 6 patients in their 80s, 1 patient in his 90s today. I need to protect them the best I can, because if I get it and spread it to them, they could have a really bad outcome. And in the Catholic Medical Association, we have a very robust coronavirus resources on our webpage, cathmed.org, because we want to bring together the best of science, research, and ethics regarding coronavirus and the vaccine. And we are encouraging people to receive the vaccine. It's the fastest and I think safest way through the pandemic.
Well, Dr. McGovern, thank you so much for coming on today and for your time and for your guidance. We really appreciate it.
You're welcome, Tracy. Glad to be of help.